Hello everyone, this is a copy of my presentation at Equitana 2022 talking about back pain in horse riders and the use of red light therapy. So we're going to be talking about all things back pain and then exactly how you can use red light therapy to treat and to manage. So who am I? My name's Annette Wilson. I'm a retired event rider. I'm a horse trainer. I'm a rider coach. I'm also a physiotherapist. I have a master's degree in physiotherapy. I've studied extensively using my physiotherapy knowledge for rider biomechanics, and I coach rider biomechanics. I'm certainly experienced. My business is called Applied Posture Riding, and my physiotherapy business is called Clare Valley Physiotherapy. I'm also I use, treat and sell after designing red light physiotherapy pads using the correct and current research to apply to horses and to humans. So what I'm going to talk about today is the structures and the conditions that will cause back pain, posture, the causes of back pain that are also medical, how back pain will affect your whole life as well as your riding, treatment available both in the acute and in the chronic stages, look at rehab for returning to health, but also rehab in returning to riding. Also going to spend time on red light therapy for people and horses and hopefully educate you on the current research. So what structures cause back pain? So we've got some photos here of the muscles, the ligaments, the disc. We haven't got a photo of the organs, but you can certainly have referred pain into the back to give you back pain. So that is pain in the back, not necessarily back pain. The fascia, the nerves, conditions that cause back pain, commonly we know arthritis and certainly trauma from either repetitive movements and or posture and or quite an extensive trauma from a fall or an accident of some sort. So how does posture affect back pain? The alignment of your joints and the movement of your muscles directly affect the resilience of your spine. So if we get 20,000 movements in a joint and we use 19,000 of those movements up in just wriggling around, that will reduce the resilience of your spine. Poor alignment, we all know that, like here with the knee, if the knee's got a bend like that backwards, then you've got uneven pressure going through the weight-bearing joint surface, and this will create wear and extra pressure on one side of the joint as opposed to the other, and this can happen anywhere in the body. Poor alignment also creates muscle imbalances. It also produces extra pressure, particularly in the back through the discs, and disc pain is very common in general population, but certainly very common in horse riders. When you've got uneven pressure, you'll have protection, and this creates an overactive muscle to protect a joint, particularly deep in the back. And with an overactive muscle, we then have an opposing weak muscle. And as the condition is not amended, then this imbalance will grow wider. Certainly poor fitness, strength and endurance all reduce the resilience. We know that, that's pretty common sense. Maybe what's not quite so common sense is the adaptations that come with the nervous system. And we need to undergo what's called neuroplasticity retraining, and this is very necessary for the rehabilitation back to correct posture. So how does riding cause back pain? You can see in all of these pictures that the back, the pelvis is not neutral. So you'll get jarring, and this happens at all paces. If the absorption of that jar is taken through joints and particularly the back, you'll get kind of like a high impact bruising. And this can happen when you've got poor lower leg stability, poor strength and poor endurance. Certainly stiffness through your hips and your pelvis. This will all relate back to causing back pain. prolonged flexion of the spine. So if you're spending a lot of time with your riding in a bend, jumping, racing, certain exercises, then the prolonged flexion can cause back pain. Certainly riding causes a lot of tension in our muscles, and this can lead to a lactic acid buildup. That will lead to inflammation and pain. Inflammation and pain leads to an inhibition of the core support muscles, and it also leads to overactivity in what we call our protective muscles. So all of these can cause back pain just because we're riding a horse. Certainly falls and all of the actions and movements and postures and lifting and twisting and bending that we do caring for our horse certainly contribute to back pain. And that's just what I'm going to talk about. So caring for your horse has a direct relationship with back pain simply because it loads the disc. It's repetitive, the loading's heavy, and we never stop. It's constant and unrelenting. It involves bending and twisting, and it's predictable. As in, we are going to lift a saddle, we are going to lift a foot, so we know we're going to load our backs. And the other thing is that, you know, you're not going to give in. So we know that as horse riders, but we do need to respect that if we have back pain, then a lot of these activities simply can be taken away from us, certainly for a time period. The intervertebral disc is the structure that is most commonly injured, and it is the most common diagnosis that is mismanaged and scares the wits out of people. Now, I know this because I see lots of people who have been diagnosed with a muscle strain or joint strain. I don't eliminate the disc in back pain until I have fully eliminated it, because I believe that the disc is responsible and certainly a contributing factor to every person who presents with back pain, simply because it is a weight-bearing, pressure-dependent and alignment-dependent structure. So if you've had a disc injury, like I was told to never ride again. Well, I didn't listen to that advice. I certainly went off and got myself better educated. I recovered. So you will recover from a disc injury, and in most cases you will return to riding again. Now, obviously that's a blanket statement that needs to be revised individually. You don't put your head in the sand at the risk of your health. You need to be educated and not discarded on returning to riding with an injury. So when you've got back pain, your skills will be affected when you ride. We are protective in nature, so we'll balance on our reins. You will lose your deep seat because the movement of your pelvis and your low spine will be affected by back pain. We tend to then protect through our toes, and you can see in the bottom picture and in the top picture, both riders are pushing through their toes, and the bottom one in particular pushing through her toes and then balancing on the horse's mouth. And we all know that that is not fair to the horse. You'll be tense. This will create stiffness. The stiffness will remain because it is a protective mechanism. You'll not be able to sit the trot, and you certainly won't be able to have a fluid rhythmical movement in the saddle while your horse is cantering. Most cases, people with back pain are behind the movement because they are scared to go with the movement, and you certainly won't be able to do any jumping. So treatment for back pain. Medical treatment, certainly we all know drugs, anti-inflammatories and pain relief. Some people move on to injections. They might have a cortisone or a local anaesthetic into a soft tissue or into a joint. Surgery is really a last resort, and every person who has back pain must undergo some sort of rehab. Now, what I do is I usually prescribe a back brace. Having been through my own back pain, putting a back brace around my belly and my back certainly gave me some support, and that gave me some pain relief that allowed me to reduce some of the protective mechanisms, and it allowed me to regain the function or the activation and then the function of my core. But I knew what I was doing. I also protected myself in how much loading I was doing. Physio, certainly very popular. Some people use chiro, whatever helps. Now red light therapy has come in for the treatment in acute and also in chronic inflammatory and pain conditions. And certainly you need to have a return to riding program. Now, returning to riding program uses rider-specific movement patterns. And when people are injured in football or netball or cricket or swimming, many will go through a return to sport specific movement patterns program. This is certainly lacking because of the knowledge in the general medical and allied health practitioners. If you don't know how to ride, you can't design rider-specific movement patterns. So this is where my skills as a rider, as also my education as a physio, have married up. So any movement patterns that are rider-specific must be trained, but pre that, you must include for every single person who has had back pain, I call it a core crunch. Now, while I was in Melbourne at Equitana, I did quite a few assessments on people just to assess their core activation. And I didn't see one person who had had the correct details explained to them on how to activate their core. Once their core is activated on demand in multiple postures, you can then go to use it in function, then you can use it in strengthening exercises, and then you can use it in your rider-specific movement patterns. So for riding, we certainly need the core crunch and the function of the core. We need to be able to tilt our pelvis forwards and backwards and sideways and rotate. We need to be able to do that independently. So isolated independent movement patterns for the arms and the legs and the pelvis, specific for rider movements, is an absolute must for returning to riding, particularly once you've got an injury to your back. Stability exercises for balance and for the postural muscles certainly need to be specific for your health and for your riding. Postural endurance and fitness exercises are a must. Riding is a very static, isotonic posture, and we need endurance in those postures more so than we need endurance and cardiovascular fitness as we do in running. So the mounted application of movement for all rider movement patterns must also be taught so that the transfer of the unmounted exercises can be used functionally for aids and paces when riding. And this is a specific education from people who know what is involved in riding, and that's certainly where my education has come in. So the core crunch, 2 essential movement patterns. If you don't do anything else, this is certainly something that you need to train. Now you can see here, I call this movement pattern 1. So if my core is engaged, my tummy flattens out, my waistline reduces, and as that muscle tightens around the spine and holds the spine for stability, it then becomes a functional movement. Now, this muscle is inhibited with pain. So as I talked before, the neural adaptations, the muscle is not connected back to the brain by an inhibition feedback. So we need to turn that feedback back on, and we do that with deliberate training. Once we've got that core being able to be engaged and then hold, we then look at here in the little diagram, the movement being able to move the pelvis forwards and backwards or remain in neutral. And this is essential for being able to ride correctly. It's also essential to be able to do that to protect your back for further injury. So here's just a quick look at some of the isolated independent movement patterns. Activating the abdominals for a deeper seat. We don't activate our abdominals as soon as we've got a forward tilt. We only activate our abdominals when we are upright or slightly leaning behind the vertical, and this is a specific movement pattern. There's no point just arching your back. You actually have to use your abdominals to extend back through your lower back or through your hips, and this is certainly a movement pattern that is just wrong in so many riders. They tend to arch their lower back and become kind of erect rather than upright. We need to be able to activate the hamstrings because the hamstrings control the lower leg, and they also have an input on how the pelvis is moved. The adductor muscles for forward and lateral aids. Our adductor muscles on the inside of our thigh, they also hold us on the horse, but we also use them in symmetry and in asymmetry for lateral aids. Coordinating the independent symmetrical function of the hands for reins. Being humans, we use our hands for balance. So the first thing we're going to do when we lose our balance on a horse is use our hands, and that involves pulling on the reins. So lots of exercises we can do to establish a better balance, but also to have a default rescue, I suppose, if you do lose your balance. I teach my riders to go to the neck strap or the mane rather than the reins to the bit. So we need to be able to coordinate that. Training the pelvic tilt independently. And if you are riding, you need to be able to bring in that pelvic tilt independent of your shoulders and independent of your lower leg. And that's what we call using your seat. So we need to train isometric strength and endurance. That means being able to sit in postures without moving around. That's what we call an isometric movement pattern. We also need to be able to deactivate the push-off action of the ankle. And there's so many more independent movement patterns that we also need to isolate and train and then put into being able to use the whole package for riding. So back pain, it will affect your life. Pain is miserable. It creates disability. We lose function. It impacts our finances. We get worried about the future. It definitely impacts your riding. So everything we've discussed so far, I'm sure you can relate to, some more extreme than others, but do not ignore it. Do not get wound up in people saying you shouldn't ride. You need to be able to be educated and make common sense, and then have some goals and some ambitions. Getting back to riding is not out of reach unless really you've had it. It's more a function rather than a not being able to do it, in my opinion. Obviously, each person's got to make their own mind up. So now I'm going to talk about red light therapy and how this will can be incorporated into your acute and or chronic management for pain management. Red light therapy is absolutely brilliant for controlling inflammation. So once the healing and the rehab is in place, you can use daily management to speed up the healing and return to function. Now, red light does have a lot of uses and actions, and I'll go through some of those as we go through this presentation. Chronic pain can inhibit progress, and this is due to the cause and effect of pain and inflammation. And as discussed, when we've got pain and inflammation, we have an inhibition of that neural feedback. So if we can minimize the amount of pain and inflammation, we can gain control of those neural feedbacks and start to activate muscles and deactivate overactive muscles. There's much research has been done. It's certainly ongoing. It's called the topic of photobiomodulation or red light therapy. So this is a safe, effective, and it's easy to use. There are no side effects. Certainly when used properly, there are some contraindications. It's relatively cheap. Certainly doesn't have the effect that drugs does. You own the device and you can use it on pretty much anywhere. There are a few contraindications, and you can use it regularly. Clinical use is growing and the home use devices are many, and the use of PBMT in horses is also popular, but misinformation and costly ineffective devices are also many. Now that's an area that I'm doing a lot of research on and developing pads that are based on current research and based on the tissue that we're applying it to, not just humans. And human tissue is different to animal tissue. So photobiomodulation therapy, it's previously been known as red light therapy, low-level laser therapy, high-level laser therapy, cold laser therapy, but PBMT is the application of light into the body to affect change at a cellular level. So it's known now across the research terms, and when people are writing papers and indexing them, the keyword, the popular term now that's been standardized is photobiomodulation therapy. But there's still a lot of research and education out there listed under these other previous names. So PBMT is red light and infrared light, and they're the main wavelengths that are used to target the mitochondria cell in the tissue. Red light is visible and infrared light is invisible to the eye. So you do need to know that when you're using a device. If you can't see the light, it's probably because it's infrared, not because it's broken. So the therapeutic benefits are at a cellular level. So this is just a demonstration of a laser handpiece. We get decreased swelling, inflammation. You can get enhanced collagen, so it is used in the beauty industry. Muscle repair. We can have what's called angiogenesis, and that is the sprouting of the small capillaries in the superficial and the deeper layers of the tissue. We can get what's called neurogenesis. The same thing is it can help repair the nerve endings that have been damaged. There are studies to suggest that it can enhance the reproduction or the turnover of cartilage cells. So in arthritis and trauma joints, certainly it's got a role there. There's also a lot of studies on using it in bone growth. So how does it work? The red light and the infrared light is absorbed into the skin, and the primary target cell, as I said, is the mitochondria. The chromophore inside the cell membrane is called the cytochrome C oxidase, and this is activated by light, and this sets in motion a cascade of cellular actions. So the red light hits the mitochondria, as you can see down here, and then that activates the cellular actions that start. With that, you kind of get it jump started and off she goes. So the primarily ATP production is increased, and ATP is our source of energy, and if we have all of these cells that are a bit lazy, not producing energy, then we've got problems within our body, including fatigue. As the ATP production increases, we get a change in the cell energy. Nitric oxide is released. This causes vasodilation, so our blood vessels open up and they can start to transport more goodies. We have what's called a ROS reaction, reactive oxidative species, and this activates what's called transcription factors, and they positively impact the cellular repair and the healing. So what happens if we jumpstart the mitochondria cell? There's many things down the track. You hit the first domino and off she goes. Now, there was a study that said by the time we're 60, we have a 50% reduction in the amount of mitochondria functioning in our body. So mitochondria cells are everywhere, and that's why red light can be placed on many different tissues for the same outcome. So the melanin in the dark tissue, the hemoglobin, which is our red blood vessels, and water are also the chromophores that absorb light. So the mitochondria, the melanin, the hemoglobin, and the water all absorb light, both red and infrared. So they're all competing when that light runs through. So melanin's found in the skin, hemoglobin's in the blood, and water is everywhere. So if you look at the diagram on the side, we've got the shorter wavelengths that will come into the epidermis, only affecting skin level, and they're highly absorbed by the melanin and the blood in our skin, so they will not move any deeper. And as you go through the spectrum, red light will penetrate through up to about 700, and then from 700 on we get what's called near infrared light. Now there's certain wavelengths that absorb better, so we get a better activation of the mitochondria, and I'll discuss those as well. So the key to success is using the correct wavelength or lengths, how much power it takes to drive each of those what's called photons through, and what the light source is. So what does it do? So we have light, it hits the mitochondria, it activates the cytochrome C oxidase, it then sets in motion a cellular reaction as all the dominoes start to fall, and each of those little dominoes has a cellular effect. So we can promote energy, promote collagen, we moderate inflammation, we can inhibit bacterial growth, and there's a cellular reaction that is explained there, not in this presentation. Promotes vasodilation, and we know now, only discovered in 2019, that mitochondria is actually in the blood. So funny they haven't found that before. It can also alter nerve conduction, the velocity of the nerve conduction, and certainly have an effect on regeneration. So inflammation is the result of every trauma, infection, illness, and certainly an age-related problem in the body. It's a normal response, and it acts to protect and start the healing process, but too much is inhibitory to the healing process. So PBMT targets the mitochondrial cell to activate the cellular reaction to reduce inflammation and promote normal healing. Now, this all works at a cell reaction. It's not a miracle one done fast effect. It happens in our body in a natural process. So the sources of PBM at the moment, we have lasers and lead light, LEDs, which is a light emitting device, and both emit red and infrared red light, depending on how they're built and what they're designed to do. So lasers are classed 1 through to 4, and they're generally classed through to read the safety and the power. So if you've got a high-powered class 4 laser, it's most likely that you're a professional. So there are rules, and these vary from state to state. But basically, a high-powered, deeper penetrating laser is a class 4, and usually only in professional hands. In a laser, the light is collimated and coherent and monochromatic. So in an LED, it's also collimated, but it's scattered, but it's incoherent or non-coherent. In other words, the waves as it runs through the tissue don't run up parallel. So non-coherent, they kind of all wobble down as they get there, but they're not in the same fluent pattern, I suppose. So LEDs are generally low power. They're used in clinics. I use them in my clinic, and I also use them for home, and I sell them for home use with great effect. It's considered safe, it's effective, it's what we call an endogenous treatment, and there are no side effects, considering you do need to know what you're doing. LEDs require no laser safety considerations, so you don't need goggles. That's why they are used for home use. You have the ability to irradiate a large area of tissue at once, and certainly they're wearable, as in you can put a battery on and move around with them. LED pads are classed as an over-the-counter device, and therefore not a prescription device. So I've done a lot of study on the optimal wavelengths. The deeper the wavelength, the deeper the penetration. So certainly an 810 won't penetrate as deep as a 905, or a 660 will even be more shallow. Now, what we know when we look at a cross-section of the tissue, we know what lies in that cross-section. So the superficial layers are dense in melanin and hemoglobin. So red light is absorbed highly, so in melanin and in hemoglobin. So all your superficial lights, like the blue, the purple, the green, and the red, are highly absorbed in the melanin and the blood vessels close to the skin surface. So the penetration deeper through is not as great, but the absorption is extremely high. So penetration must not be confused with the absorption of the light. So the shorter wavelengths will hit your mitochondria in your superficial levels, the chromophores being melanin and hemoglobin. The deeper wavelengths are also absorbed by melanin, hemoglobin, and water, but the deeper wavelengths with a higher power can penetrate through to the deeper layers and be absorbed by the mitochondria, up to 5 centimeters deeper. So you get good absorption deeper in fair skin, so it's not congested or taken up at the superficial layers. So the optimum effect for mitochondrial activation is between 600 nanometers, which is red light, right up through to 1020, which is infrared light. And at this end of the scale, mostly it is absorbed by water. So the 660 light penetrates up to 1 centimeter and is absorbed at the superficial chromophores, while the 850, 905 light can penetrate up to 5 centimeters. Now, with darker skin, the wavelengths are, you do get some absorption at the skin level, but with the longer wavelengths moving through the superficial levels, you do get a good absorption into the deeper tissues. So the optical wavelength, as we can see here, is between 600 and 1200, and we can see that as the different chromophores in the graph versus the absorption. So high absorption in the shorter wavelengths of the melanin and the hemoglobin, and less absorption as it penetrates through with the deeper and the melanin, the water, and the mitochondria can be targeted in the deeper tissues. So here you can see a graph. On the vertical, the amount of absorption, on the bottom graph, the depth of the wavelengths. So you can see that the absorption at red light, at the 660, at the deeper levels is less, but when we go down to the 905, 810, you can see here the absorption at cytochrome C level is maximum around about 810, then it peaks again at about 905. So that's why these wavelengths are used. So if you want to treat superficial, you use red light and the shallower. If you want to treat deeper, you go to the infrared light, infrared wavelengths. So devices for home, these are LED devices, and I've recently just read a study saying the use of LED devices with certain wavelengths have a similar outcome to using a laser with a diode. Of course, these need to be replicated and duplicated, but certainly good information for those people using or producing LED pads. We now know that the LED light source used with a smaller power over a longer period of time, the outcomes with the measurement of inflammation pre and post is very positive for the use of these devices versus the use of laser, certainly from an access and a cost and a safety point of view. So you can buy these everywhere. So if you're looking for a red light device, you do need to understand what you're buying and why you're buying it. There's very many devices out there. Some are very expensive and some are grossly cheap. Be very careful with what you're buying. So most come with a standard wavelength, and this has been around for many, many years, the two wavelengths of 660 and 850. These two wavelengths were set up on the research many years ago and certainly a very effective two wavelengths, but more research, we can do better. We can design pads and lasers with more effective penetration and more effective absorption. So most of the devices that you're buying off the net are 660 and 850, and they come with either a remote hand controller or button controller. Some are battery operated and some are plugged into a 240 volt power source. If you're using a US bank power adapter, you do need to understand that the power in some of these lights is, you need a good strong power bank, and often they don't tell you that when they're selling you the device. So most come with what's called continuous or pulsed. You do need to buy a gadget, a device that has both options. I have a device that has 3 wavelengths. You can use it as red light or a combination of red light and infrared light, or you can use it just as infrared light. Certainly very many prices. sadly, the animal devices that are on the market copy the human devices. So the marketing is all the fantastic stuff that Redlight does, but what they're missing is what Redlight does to dark skin or hair. So yes, red light and infrared light has got many uses, but if you block it with dark skin or hair, then those uses are significantly decreased. And certainly a lot of the animal devices are very expensive. So what we've discovered is if we use the pulse mode, it's more effective for pain, and this is reproduced in many studies. The continuous mode is more effective for wounds and hair growth and skin conditions. Now, these are statements I'm just making over from the research that I have done and the knowledge that I've gained. So you need to do your own research if you really want to delve into some of these areas, but this is what I have learned so far. The LED pads are very effective, but most effective when you use them daily. So that it's a drip feed into activating the mitochondria, and as it is activated, it's like taking a pain relieving drug every day that doesn't have any side effects. But you do need to know what you're doing when you're going through dark skin. So there are some deeper wavelengths out there that are providing better quality absorption. So what conditions would benefit from PBMT? Certainly chronic inflammatory pain, back pain, neck pain, arthritis, muscle, joint, sports injuries. Huge amount of research is being done in brain injuries, acute and chronic brain injuries, stroke and Parkinson's disease, but it's also being used for anxiety, depression, sleep deprivation. Huge amount of research specific to treating brain. Certainly soft tissue injuries, great success with nerve injuries, and if you're also looking for benefits with acne, wrinkles and scars, the red light does have an impact, a beneficial impact on those wounds and skin conditions. So red light, because it targets the mitochondria and makes a difference to the activation of that downstream, or the cascade effect, it certainly has a wide application. Safety, it's an endogenous treatment. There are no reported side effects, although there are contraindications. It's non-thermal. You do get a little bit of heat through the pads. If you're getting too much heat, then the setting is wrong, the power is wrong, or the administration is wrong. It's bought as an over-the-counter device. Therefore, it can't come with descriptive prescriptions. So if you're buying one with a lot of how to use it, they're making claims a little bit outside their area of expertise, unless they are an expert on that device. You need to take care with dark skin and tattoos. You will burn your skin if you place it over the LEDs, not so much, but certainly the lasers. Very careful with people who've got photosensitivity. You need to know the specifications of your device, and the instructions on the settings are usually not included, as I said previously. They might give instructions on how to set the device up, but not why to just set it up. So the contraindications, eyes, as much as red light can be beneficial for eyes, it's not recommended that you do it. Certainly if you've got a class 3 or class 4 laser, you need goggles. And unless you're a professional, you're probably not buying one of those. But if you're having it used on you in a clinic, more than likely you will have safety glasses applied. The light from the LEDs does not require eye safety glasses. Contraindication is over a pregnant belly, simply because we don't know what the activation of the mitochondria does to the growing fetus, so just stay away from it. It does activate cancer. Again, there's a lot of research on how red light and infrared light can be used to destroy cancer, but at the moment, because it's an over-the-counter device and it's an activating treatment, don't place it over cancer. Over cancer, skin cancer, or any areas in the body that have cancer. Chemotherapy, if you're having chemotherapy for cancer, you can reduce the side effects where you isolate the use of red light, but I'd be certainly only doing that under the guidance of your specialist. Epileptics, because the light flashes, it may cause a fit. So again, if epileptics are using red light, more than likely they're under the guidance and the prescription of their specialist. Don't put it on acute bleeding because it does vasodilate. If you've got an electrical device or a nerve stimulator, just stay away from those points. certainly, as we mentioned, photosensitive people, and don't put it over tattoos, because a tattoo is got ink, and the ink is absorbs the light and may burn. So how to use it: must be applied to the skin. So here's a few examples: directly on the skin, and in the horse it's directly on the hair and strapped on. You don't put it through clothing. Your best effect comes with a direct application. It's also preferred to have a little bit of pressure of the light into the skin so that you don't get too much scattering or reflection. So you can use the straps and the body weight to apply pressure. Most have an auto timer up to 30 minutes. Don't do any more than 30 minutes on one body part at a time. There is such a thing as overdosing, and if we overdose, then the effect of the mitochondrial activation is reversed and actually inhibited. Now, you'd need to do a fair amount of red light therapy, but stick to the guidelines. You can apply it to the same spot, once to twice a day, but give the cells a rest. You can use it on multiple areas. So I use mine on my knee, my elbow. I wrap my little device around my hands, and I use this little neck device around my neck. So just while I'm watching TV, hook it up to the battery, or in the case of the big pad, hook it up to the power point, and it's like taking an anti-inflammatory that feels good and has no side effects. As said, the pulsed wave will allow for a higher power setting and is usually non-thermal. You usually get a better response with the pulse, but if you're looking at other conditions for the skin, you might want to use a continuous wave. And again, it's a matter of knowing what you're doing and why you're doing it. Keep it clean with a soft white. Take care with the power inputs. They can get tugged around, and because it's an electrical device, the wires can break, and you might find that you don't have lights being lit up. So don't get it wet, and certainly don't store it in damp areas, and I also wouldn't let it be stored in extreme heat. Don't stretch it, fold it, kink it. Other than that, they're pretty durable. So a summary and a conclusion of what we've just talked about. So the topic was back pain in horse riders and the use of red light. So back pain is serious and it's common in horse riders, and it must be assessed, treated, rehabbed and managed properly. And then riders must undergo a rehab specific for returning to riding. And this is the area I find is lacking. Many people return to riding having done a bit of a gym program, but they don't understand how to activate their core or their isolated movement patterns, because that neural pathway has been altered and not regained with unmounted specific training. So the returning to riding is very, very important. It's just very important. You must manage pain at home, and this can be done in the acute stage with drugs, heat, braces, core strengthening training, and certainly, as I've discussed, PBMT. We're all moving away from drugs to self-management, and red light PBMT is certainly evolving as a front runner for that use. Treatment should be applied as needed. Over treatment and under treatment, Goldilocks got it right. So you need to talk with your therapist, discuss what you're doing and how you're doing. I do see many people that overdo their exercises, and I also see people who are too scared because of pain. No pain, no gain is only of value if you know why, what, how, and as needed. So follow the advice. If you're pain-free, manage it. We tend to only manage pain. If you don't manage no pain, it will return, and return to riding when advised. This usually comes from a person who is in the industry, not necessarily your PT doctor who knows nothing about horses, because more or less they'll say don't return to riding. So don't give up, unless your injury is catastrophic and it is just out of your range. And certainly I'm happy to talk to anyone about what I've presented today. So find the contact details related to this presentation, or contact me through my website pages, and they'll be listed as well. So any questions, you can certainly send them in via the websites. The websites are there now. So Applied Posture Riding is my business. I'm a physiotherapist. You can follow me on applied posture riding on my Facebook page. Don't send me a friend request. I don't gather friends. I gather followers under the applied posture riding Facebook page, and that's where I put all my information on Redlight therapy, new products, and the information that I am gathering. So I hope that's been of use. Good luck, enjoy, and hope you enjoy what the future holds for you.